We are the Lancaster County Democrats, and we have Jennifer Carter from the Nebraska Appleseed, and we are talking about health care reform today. Please give us more detail about what the public option is.
Sure. So I think the main benefit to a public health insurance plan is that because it would not have a profit motive, and because the way they've structured it thus far, it would have to work off the premiums that it collects, is a few things. One, the hope would be that there would be, because it would be in part, it might not actually be run by the government, but it's obviously the public plan, a health insurance plan, even if it's actually administered by a nonprofit, would hopefully have some really strong negotiating power so that the folks that it's negotiating for with hospitals and providers and those would be able to do as good a job as Blue Cross and maybe better and others in negotiating good rates. What I think is really key is the different orientation in a public health insurance plan. Because there isn't that profit motive, it really needs to be focused, if it's going to work off the premiums that it's collecting, on making sure it's delivering the most efficient care in doing what is really works best for consumers, both so that they get the health care that they need, which in the long term will give them the cost savings that they'd be looking for to be able to reduce premiums for other people.
So it creates some competition,
yes,
for insurance companies to raise the standard,
right,
of what is the access to care to a higher level.
Right. So yeah, I mean, it really, the lack of profit motive won't be responsible for all of the reduction in premiums, or why it might be a more affordable plan, but certainly that would play a large role. And you'd hope that if they could run it efficiently on the premiums they're collecting, that might put some pressure on private insurance companies.
And I think
to do
the
the same.
Opposite would happen too, because
Right.
if you continue to have private insurance, then you would still have this competition going on, where
Exactly.
you wouldn't have a government bureaucracy become mired
Right,
with
right.
red tape, because they have to rise to the standard
Right.
of what the private sector
Right.
can do. So
Yeah, exactly.
both would go and help compete.
Right. And if you require them to be using only the premiums that they're collecting, then I think that's exactly right. Then they've got to learn to create whatever efficiencies that may be being created in the private market. You would hope that they'd all be learning from each other to give the best product to consumers. And actually, I don't like using the word consumer because I personally don't believe that healthcare should just be something that's accessible to the highest bidder or the person. This is not a car. This is
It's a basic right.
Right, and even if you don't go so far as to say it's a right, it's a public good, and we have to really, I think that's the fundamental question here, morally and otherwise. What kind of society do we want to construct? Do we want people to have access to the health care they need? Then we can build off our private system, but you're going to structure it in certain ways to make sure that it's not just people who can afford it that actually access it. And I actually really believe our economy, our society, everything will be strengthened when this is kind of taken off the backs of a lot of people. And you know, everyone should contribute. And that's another thing all the bills do. It tries to spread responsibility. So I have to pay my fair share. I have to pay what I can pay. And not just what I can pay, you know, I have to pay a certain, I'm going to have to contribute. But also they're asking employers to contribute, they're asking the government to contribute with tax credits to help people purchase coverage, which would be another big factor in the exchange. And so I think that's an important
Now, when
part
we
of
talk about costs, I hear lots of different things out there, and I think there's just a lot of misinformation.
Yeah.
I hear things of the effect, well, we'll pay him for 4 or 5 years and not get any benefit from it. What's your response to that?
My understanding of the Congressional Budget Office's analysis, and they're a nonpartisan group, is that, I mean, it is true that there'd be some very immediate benefits that people would see in terms of insurance reforms, but a lot of stuff wouldn't be implemented for a few years, and part of that is just getting that up and running. I mean, instituting new things, even in a private market, takes a long time. So I know it's been said, well, we're paying for it for 10 years and we're only getting 6 years of benefit. But the CBO considered that in its analysis, and they actually believe that the second 10 years, you're still going to see significant reductions in the federal budget. Because if we can actually get a hold of this system and start delivering care more efficiently, there's a real belief in their analysis that we're going to see some bending of the cost curve, and that we'll actually still see some.
I also, if I recall my history right, that it took a while to phase in Social Security. It wasn't like, boom, one day Roosevelt said, oh, let's have retirement for the elderly. It took a while to build up the fund, and it took a while for people to be able to access that. And that different years of when you were born, particularly early on, influenced the level of how much you could access. Because you have to pay into it, you have to build up the fund.
Right. I think that's probably right. And I don't know actually the Social Security example as well, but I do, there's a couple of fascinating pieces that an oncologist a surgical oncologist in Boston wrote. His name is Dr. Atul Gawande, and he wrote them in the New Yorker, and he's been kind of part of the national discussion. And his point in talking a little bit about a different issue, but with Medicare Part D, I think, provides a good example where it was just one day everyone woke up and they needed to be on Part D, and it really created a state of emergency, literally, in several states, and there were seniors who weren't getting the medicine that they need. And so you have to really be careful when you start setting these things up. And I think it makes sense, while we'd all like to see improvements tomorrow, it does make sense, I think, to do this carefully.
To face it.